Hello, my name is Andrea Hamon Lasso. I study physical therapy. Um, my topic is the role of physical exercise in combating neurological disease. The definition is physical exercise is a planned, structured, and repetitive activity that seeks clear objective as a goal. One of the main organs that benefit from the activity is the brain, and that is why those who suffer from a neurological disease must take the possibility into account within their treatment guidelines on the neurological disease, and includes all those diseases that they affect the central nervous system and the peripheral nervous systems.
Topic of central neurological. In this video, I want to introduce the topic of central neurological disorders. Central neurological disorders, or disorders that primarily affect the central nervous system. Because the central nervous system is involved in most of the neural functions, these disorders may lead to abnormalities of either the lower or the higher neural functions. So they may cause motor, sensory, or autonomic abnormalities of body parts that have connections to the part of the central nervous system that's affected by the disorder, or they may cause abnormalities of cognition, emotion, or consciousness if there's involvement of certain parts of the brain, particularly the cerebral cortex, the outermost layer of the cerebrum. And just like with the peripheral neurological disorders, I like to divide these into focal versus diffuse disorders. So focal or diffuse. And the disorders that cause focal syndromes can affect either the spinal cord or the brain. And many types of pathology commonly cause focal central neurological syndromes, including disorders that fall into the pathology categories of idiopathic, vascular, mechanical, autoimmune, and neoplastic disorders. Even more types of pathology can cause diffuse central neurological syndromes, and these diffuse syndromes are usually related to widespread abnormalities of both sides of the cerebral cortex, the outermost layer of the cerebrum. Disorders that cause diffuse syndromes can include those in the pathology categories of genetic, idiopathic, vascular, epileptic, mechanical, metabolic, infectious, nutritional, and toxic disorders. So there's a very long list of disorders that can diffusely affect the brain. Epileptic disorders in particular, which are disorders that involve seizures, can cause either focal or diffuse central neurological syndromes, because seizures can start in just one part of the brain, causing a focal syndrome, and they can either just stay in that spot or they can actually spread to involve most of the cerebral cortex on both sides. Or some seizures can involve most of the cerebral cortex on both sides right from the beginning and cause a diffuse syndrome right from the start. So this is a tough category to introduce in a short video because the central nervous system does so many things that focal or diffuse dysfunction can cause a large number of syndromes, and a large number of different types of disorders and pathologies can affect the central nervous system. So this makes this category particularly challenging for making the diagnosis of these cases. And I'll just stop here, but obviously there's a lot more details we can go into in later videos.
In the application in physical therapy regarding neurological disease, it should be noted that nowadays the practice of physical activity is part of rehabilitation and neurorehabilitation programs. It is currently recommended as part of the treatment of many of them, but with attention to its patients. In patients with Alzheimer's disease, there is thought of a possibility of slowdown in the degenerative process of neuron that occurs in the pathology. or even it is of its possibility help in the prevention of cognitive decline or in preclinical or initial situations.
Arranged. Patients who've previously been told they were imagining their pain are now finding relief through a new clinic in Brisbane. It's the first of its kind in Queensland and sees specialists working with patients to repair what's described as a glitch in their brain.
Brittany Smithers was sick of being told the excruciating pain she felt was all in her head.
I had MRI scans, blood tests, x-rays, and they just didn't really find anything.
She'd broken bones after jumping from a wall. A year later, they'd healed, but she hadn't. Life in a wheelchair beckoned.
This one, lift up hard as you can.
Julie Wright's experience was similar.
No balance, falling backwards. My left leg was very weak.
After endless tests, the pair were eventually diagnosed with a functional neurological disorder.
These are very disabling disorders. These are life-changing disorders that stop people from working, stop people from functioning in society, functioning as part of the family.
But Dr. Lenz says it's a condition which is underdiagnosed, often because of a lack of acceptance in a medical sphere which relies on test results.
And really in the last few years, these disorders are getting more accepted because we have the evidence as well.
He's now set up a clinic at the Mater, one of only 2 in Australia, to help treat the condition.
My hardware was fine, which my body, but my software was basically stuffed.
20 to 30% of people who present to neurology outpatients have functional neurological disorders. It's the second most common reason people seek help after headaches. For Brittany Smithers, life is getting back on track.
I have a running plan.
Not bad for someone who was facing life in a wheelchair. Leonie Mellor, ABC News, Brisbane.
The Greek government
And the pros and cons. In the pros, through physical exercise, better cardiorespiratory state is obtained. It is related to the supply oxygen and not improved by the cardiovascular system and lung. The ability, the muscle to use this contribution improves muscle strength, the ability on muscle or muscle groups to generate tension under specific conditions. In the cons, you must have a correct knowledge of the capacity of the patient, otherwise you could get hurt and instead of better you will feel worse. Not all physical exercise can be applied to people with neurological problems.
Bigger. Your lungs breathe that movement is good for your body. Your muscles grow bigger. Your lungs breathe deeper, and your heart pumps easier. But what about your brain? Scientists have been studying the effects on movement of the mind for decades to answer this question, and have found that physical activity is just as beneficial for your brain as it is for your body. Regular physical activity helps you learn faster and think clearer. It helps maintain good mental health while reducing risk of mental illness. It enhances, improves, and protects your mind. Now, at first that may sound surprising. Instinctively, we assume brains are best when left at rest. But researchers have proven that this instinct is wrong and uncovered reasons why minds need movement. One key discovery has been that physical activity releases a protein in our brains called BDNF. BDNF has been called Miracle-Gro for the brain because it acts like a fertilizer, helping our brain grow, create new cells, and forge new connections. By increasing levels of BDNF, movement allows our brains to blossom. More and more benefits are discovered each day, like improved memory, enhanced focus, faster learning, heightened creativity, better problem-solving ability, and reduced risk of anxiety, depression, dementia, and cognitive decline. Movement isn't just great for our physical health, it's a necessity for our mental health. And just like our bodies need physical activity to grow stronger, our minds need it too. Brought to you by Participaction.
The issue played in Ecuador exercise in the muscle that make up the recovery in epilepsy patients. Only progress in functional dependence was evidenced in 5 male patients, and obtaining that in the portal test, 25% progress and was made in dressing, washing, and bathing activities with a frequency of 2 respecting the activities of urination and going to the toilet, and improving was observed in 30% with a frequency of 1 respectively. On the genetic scale, 0% progress was not evidenced. It is concluded by showing that the application of the exercise in the muscle that make up the recovery significantly proper functional dependence. In conclusion, physical exercise is important in patients with neurology problems, but care must be taken in the way in which it is going to be performed. A plan must be made, which must be based on physical capacity of the patient, on their age, and the possible force range to have a better result.
My name is Mariela Graciano. I am a physiotherapist and I've been working for 30 years with people with Parkinson's. I would like to share with you different ways in which you can manage your mobility problems in your daily life with Parkinson's. So, let's explore together exercises, tricks, tips on how best manage your life with your Parkinson's. Now let's try to get another strategy. As Parkinson's progresses, complex motor sequences may no longer be done automatically. Your physiotherapist will show you how to solve this problem, and then you just give a nice round by breaking down a complex task into different sections and doing one at a time consciously. You turn round like this and you stand up. You come to the edge, feet back and up, wherever is comfortable for you. Cohen was diagnosed 9 years ago. He wants to learn an effective way to get in and out of bed. You got a gap here. Ideally, we need a bigger pillow. Do we agree?
Yes.
Shall I change it?
Please.
Yes, so the strategy is adapted to your needs. For example, Cohen needs a suitable pillow and the right mattress for him.
Much better.
That's it. That's good. So now, from your side, just you're going to turn on your back, but helping yourself really nicely with this hand. Really big movement and touch the edge of the bed. Good. Concentrate on each step and take your time. Foot flat, the left foot flat. Feel with your hand you got enough space to roll over. A strategy needs to be practiced, tested at home, and improved with your physiotherapist until it works for you. And then bend your knees and push with one hand, the other. Straighten up, looking at the level of your eyesight. Bring yourself to the edge. Feet back, trunk forward, and stand straight and go. These videos are an initiative of the Luxembourg Parkinson's Study.
Thanks.